Hi you guys. So today I am going to go see an acupuncturist and I'm going to ask all kind of questions about acupuncture and pregnancy. So let's go. All right, so I have Mark here and I'm just going to ask Mark some questions and then in turn he can ask me some questions, but let's just see what acupuncturists do.
Yeah.
Okay, so the first question is, what is an acupuncturist and is there special schooling that you have to do?
Yeah, licensed acupuncturist in the state of Georgia needs to complete a 3 to 4 year master's program. Once you complete the master's degree, then you need to sit for 3 to 4 national board exams. Once you pass the national board exams and you graduated from the school, you're eligible to apply to the Georgia Composite Medical Board for your acupuncture license. That medical board is the same place that a physician gets her license from. And then if you're coming fresh out of school and you have not had 1 year postgraduate experience, like you had a license from another year, for the first year of your practice in the state of Georgia, it needs to be under the supervision of another licensed acupuncturist who's been in practice for at least 4 years.
This is serious.
That is
Yeah.
a licensed acupuncturist.
Yeah.
And you mentioned pelvic floor and PT, and also just tell you that PTs do something called dry needling that they insist is not acupuncture. I assure you it's acupuncture.
Is that okay?
Yeah, and unfortunately they're only required to take 2 weekends of courses.
Okay.
They're brilliant for all the wonderful things that they can bring for their patients, but it's really not safe to get dry needling from a PT who's only taken a weekend or 2 weekend workshops.
Got it.
It's an invasive therapy.
Yeah, I was gonna say, so what?
Yeah.
Why is this schooling so intense? Like, what are we looking out for? Like, what could go wrong?
Yeah, sure. There are cases where physical therapists have created pneumothoraxes. You're a nurse, you know what that is, but for the public, that's whole punctured lung.
Yeah.
Spinal cord, injuries, nerve damage, etc. And generally, the PT wants to put out that what they do is not acupuncture, because they're not thinking about things in terms of yin and yang or chi or energy. But Chinese medicine exists for thousands of years, and we're not static. There is only one way to find an acupuncture point, and that's to palpate bone, muscle, and we will find the points in the same way that PT will be. So basically, the AMA, that's the American Medical Association, says that dry needling is indistinguishable from acupuncture. If you're not a physician, the AMA recommends that you complete the training that is equal to a licensed acupuncturist, which again is a 3 to 4 year master's program.
Yeah.
The Georgia Medical Board says dry needling is a technique of the practice of acupuncture. So both national big picture AMA and little picture Georgia Medical Board recognize that A equals B. So the training should be the same.
Right.
So there's a lot. So that is the difference in the amount of training. For dry needling and acupuncture, the needle is the same.
Okay.
The technique is the same. The location is the same. 3 things that are the same. The only thing that's different is the amount of training necessary to assure public safety.
Okay.
So you have to be careful of that. I just put it out there.
Okay.
Yeah, go ahead.
So speaking of being careful, then,
yes.
when you are dealing with a pregnant person, first off, what can acupuncture provide? What benefits for a pregnant woman?
Sure. First, so Chinese medicine is generally thought to be consists of 5 branches.
Okay.
And acupuncture, Chinese herbs, a Chinese medical massage, a Chinese medicine version of diet and nutrition, and kind of movement therapies like Qigong and Tai Chi. Like I'm sure you've heard of yoga.
Yes.
You've probably heard of Tai Chi. So that's our kind of movement, kind of healthy therapy. So historically, women's health, it's the specialty of women's health, going back 1,800 years to a massive book where we can look at 3 chapters of the book. The 3 chapters, when we go to women's health, OB/GYN, it's all herbs all the time.
Yeah.
Not much acupuncture going on.
Okay.
And then in China, if you're not feeling well, you can see an MD at a Western hospital. Most of the medications and surgeries we have here, they've got there in the Western hospital, and maybe there's a small acupuncture department in the Western hospital. Or if you're not feeling well, you can go to a Chinese medicine hospital where it's delightfully integrated with Western medicine, like nowhere else on the planet. So if the woman was going for infertility, gynecology department, husband would get semen analysis, wife would do blood work, ultrasound. Chinese medicine doctor in China has more education and Western training. She'd do a pelvic exam. We don't do it here. The doctor would ask the patient about her health history, could prescribe birth control or a medicine to help ovulate, like Clomid. But you might be surprised, sort of as an outsider to Chinese medicine, that after all of the information gathering in the gynecology department in a modern Chinese medicine hospital, she's not going to do acupuncture. She's going to prescribe Chinese herbal prescription. Because it's always been an herbalist specialty. So back to your question, acupuncture. So the first trimester, my recommendations for my patients that either they conceived with me because they were coming kind of on their journey through fertility, continue the acupuncture and the Chinese herbs for the first trimester. And our goals are try to reduce the chance of some types of early pregnancy loss. What types? The types that are not genetically broken. Genetically broke, sadly, the fertility doctor, the gynecologist, no one can fix. It's just not meant to be happy, healthy baby you. But there are other reasons, sadly, sometimes a woman could have a miscarriage or loss. And so we treat with acupuncture, we treat with Chinese herbs. Second thing, if you would go as a medical person, if you would go to PubMed and look, there is so much research about acupuncture for nausea and vomiting. For two kinds, for chemo radiation situations, and the second is for during pregnancy. So then the acupuncture is, it is to try to reduce morning sickness. It's trying to, for the idea of Chinese medicine, to have a happy, healthy pregnancy. And so I usually recommend weekly for the first trimester with acupuncture and Chinese herbs. If they have a history of recurrent pregnancy loss, then we've been doing treatment for weeks, if not months before, to help them get pregnant. We're working side by side with a gynecologist or a fertility doctor. So my patients are often doing the best of both worlds, Eastern and Western medicine. Second trimester, many people, they might take a break from acupuncture. If everything is going well and there's no second or third trimester pregnancy losses, second trimester, I recommend we stop the herbs. It's not that they're unsafe, I just feel we don't need them at that time. Second trimester, a person might come once every 2 to 4 weeks, where they might take a break. They might, work on aches and pains, things that come with pregnancy. Second trimester is kind of a sweet spot for many women. Acid reflux, stress, anxiety, daily life, you could think of it as a wellness kind of thing. Third trimester, same thing. Anything that you might see in pregnancy, Chinese medicine may have something that we can support or help to treat or make the person more comfortable with. Third trimester, people might have taken a break or might recommend to come for acupuncture kind of wellness regimens for pain. Could be back pain, could be carpal tunnel pain, could be pubic symphysis pain, could be a lot of different things. Two things, and a person might come third trimester maybe once a month. Or if they've taken a break the whole time since the first trimester, two big things that I'd love your people to walk away with, and I'll give you a little thing so that you know. At 34 weeks, if the baby is breached, if the baby is not in the right direction, facing the right direction, if the baby's breached, it's close to 34 weeks. In my head, I have it that if we do nothing, maybe 50% of the time the baby will return by itself. And there's research to show that we have this thing from Chinese medicine, it's called moxibustion, or it's moxa for short. If we apply that over the course of 10 days, I bring, the wife comes in, I ask her to bring her husband or partner, and I teach the partner to apply moxibustion to an acupuncture point that's on one of the toes. So what is moxibustion? We can stick a needle in an acupuncture point, that's acupuncture. We can stick a finger in the acupuncture point, that's acupressure. And then we also can take an herb that we normally would cook with some other herbs and drink and make a medicinal tea. But if we shape it, press it, roll it, turn it into like a cigar-looking thing, and we light the tip of it, it's orange, and we hold it near the skin. We don't burn the skin or touch the skin, but we're using the heat to stimulate the acupuncture point. That's moxibustion, or short, it's moxa. So as far as helping breech babies goes, Western medicine has what they're able to offer, and this is from something from Chinese medicine. I always recommend people also to spinningbabies.com, and also always recommend to chiropractors who have experience with Webster technique. So that's that. And the last thing I like to tell people is third trimester from 36 weeks. If I haven't seen my patient for a while, haven't seen my person for a while, recommend they come back the last 36 weeks. There's research from faraway places like Germany, New Zealand, Australia. The author of the book, Acupuncture and Pregnancy, Deborah Betts, she's from New Zealand, and so some research done in that part of the world says acupuncture, like sort of a fixed research protocol, offered in the hospital once a week, 36 weeks. once a week at a hospital by a nurse who has some training, it's basic training in acupuncture, or at a private setting office of an acupuncturist. Once a week for 4 weeks, we have 3 benefits. Okay, lower C-section rates.
Okay,
that's great
yeah.
because we know some hospitals the C-section rate could be 30 to 40%.
Yeah.
But the WHO tells us only 10% of them might be out of medical necessity for the mom and the baby. So I would like to see lower C-section rates. Lower C-section rates, shorter duration of labor, and less pain reported. So those are all fantastic things. So that's kind of week 36 to week 40.
Okay.
Once we get to the due date, we don't say that we induce labor. I would always recommend that a patient not call an acupuncturist and say, I'm looking for labor induction. And then we can say, well, your OBGYN can do that for you.
Got it, okay.
We're not stripping membranes, we're not prescribing Pitocin, we're not giving Cervidil, we're doing acupuncture. So you can kind of think of, we're doing acupuncture to transition the woman to labor naturally. That's different than
like a natural stimulant.
Yes.
And it's just the same spots?
No, it's not. The points that we do in the first trimester, different than the ones at 36 weeks for, we call 36 week to 40 weeks. That point prescription or those points is called labor preparation.
Got it.
And then once we get full term, then there's a different set of points that we would use to transition the woman to labor naturally, not induce labor, but yes. So anyway, and then those treatments after 40 weeks, we might do them once a week, or I think it's less of a thing at your practice, but at other practices where the doctor might like to impose a limit at 40 weeks or 41 weeks. If someone draws a line of saying the patient will not cross this amount without inducing them, then stronger than seeing them once a week is, we might see them 2 or 3 consecutive days right up to the line of when the doctor would like to induce the patient.
Okay.
So that is some basic things that I tell the patients.
That was good. Okay.
It's a lot.
It is. I learned a lot. I didn't know that. So benefits would be helping with fertility, then helping with possible things going on, so discomforts like nausea, hyperemesis basically, and then also naturally transitioning you as well as breech. Is the positioning for breech the same as the other ones?
Yes.
Okay.
Like breech strictly, and other variations on the baby is not head down with facing the back of the mom's spine.
Okay.
We can say generically breech or malposition of the fetus or the baby. We would teach the person the same thing. And I've not seen good research that says acupuncture is helpful for that.
That's my next question. If you follow up and see did it help?
I don't always follow up. Sometimes the person is just not a regular patient and she's just coming for this regular thing. So if the person was my person, my existing person that I helped conceived, or she came to us while she was pregnant, then yes, we're usually following up. And if she were in the 36 to 40 week mark, we might be seeing her for labor preparation acupuncture. But there is a study out there that talks about acupuncture and moxa for breech, but I think it's kind of flawed. Like we already know that moxa can help breech babies some of the time, and that study looked at acupuncture with moxa compared to the regular treatment. Well, I think they need a third arm of regular treatment, acupuncture with moxa, just moxa or just acupuncture. How do we know it's the moxa or it's the acupuncture? So anyway, it's my personal preference that I'm not interested in charging a person for an acupuncture appointment where I don't see the evidence or research behind it. Talk to 10 other acupuncturists, they might have different views. Many of them would treat with acupuncture for breech baby.
Okay. So not really beneficial.
I believe not. But, we're in Georgia. We can say there's more than one way to skin a cat. Different people might have different views. I give you my view. I think that labor preparation, labor transition, acupuncture. Baby's not in the right position. I'm going to go moxa. I'm not going to think acupuncture.
Got it. Okay. So there's the herbs would be more beneficial than the acupuncture.
That external herb, this thing called moxibustion. Yes. We would go with that. Moxibustion or moxa if the baby is breathing.
All right. So I'm about to get acupuncture. I'm a little nervous. You can say hello.
Hello, everyone. This is Lanika Acupuncture demo. As if Lanika was first trimester pregnant, these are some of the points that we're doing, but we won't talk about Lanika's pregnancy status at this moment. It's just a sample treatment.
Not help you get pregnant, right?
Oh, that's not what we discussed today. That's not what we discussed today. That's a different treatment.
Good, okay. We don't want that treatment.
So I'm going to go top to bottom and we'll get some points in.
Do I just like this?
Yeah, that's it. Otherwise, okay. If we need to move something, I'll tell you. So generally, I have the person sitting in a stool, and we get 4 or 5 needles in the scalp. Today, we're going to keep it simple. We're just going to get 1 point at the top of the scalp.
Oh, I got going on here.
Your hair is good.
Okay.
Take a breath when you exhale.
Okay, you guys, so that was a very interesting experience. I had no idea about any of the Chinese medicine, so this was new territory for me, but I learned a lot. Mark is super smart, and he shared a lot of education and some of his knowledge with me. I didn't know that acupuncturists had to have so much schooling and how intense it was, but when you think about it, which I didn't have time to think about, but when you think about it, they are penetrating your skin where you have veins and arteries and nerves. So I appreciate the fact that they do have a lot of schooling. So if you're out there, make sure that your person who's doing acupuncture has a lot of education, as he mentioned. Did it hurt? It actually didn't hurt. I was a little more nervous than the actual situation. I felt like a prick and like a whoop, and a zing maybe, but that was it. And I'm actually scared of needles, so if I could say that, then I think you could believe me. But it didn't hurt. It was just kind of weird because I felt like I couldn't move my hands or move at all. There was one in my head, and I thought Mark was gonna judge me because I have clip-ins in. But he was great. So there's that. But yeah, it was awesome. If you need an acupuncturist, definitely come out and check out Buckhead Acupuncture and Herbal Shop and ask for Mark. Bye, you guys.